Polycystic ovary is a common condition and it is present in 20% of the young reproductive women. In this condition, there are lots of small follicles in the ovaries, but the maturation of these follicles and the ovulation occur erratically, and that seems to be the problem. Many patients with polycystic ovaries have irregular periods and oligomenorrhea. Some of them have amenorrhea as well. They don't have period for 1 or 2 years sometimes. Some women don't have spontaneous periods at all. And some women with PCO, when they have the syndrome, they have high testosterone or androgen levels and symptoms due to that, like acne and hirsutism. They also tend to put on weight and they have insulin resistance and all the metabolic syndrome associated with that. This is what is known as polycystic syndrome, polycystic ovarian syndrome, sorry. Now, the polycystic ovaries is a range, I would say. It is not one condition, it's a range of conditions. A lot of people ask how the polycystic ovaries are caused. In fact, the cause is unknown, and sometimes it runs in families. And in fact, I have a patient whose aunt and sisters have polycystic ovaries, so I call them polycystic ovarian family. And so it's common in families, and in that case, it is inherited. There are some probably genes associated with the polycystic ovaries. And the polycystic ovaries is said to be more common among Asians, South Asians. The incidence in Caucasian population is 22% to be exact. And in Asian population is 40%, is nearly double, which is a high incidence. And there is a link between this polycystic ovaries and diabetes. If you look at the families with the polycystic ovaries, the brothers have diabetes or brothers have a high risk of diabetes developing later in their lives, and sisters have history of polycystic ovaries and history of diabetes or at least insulin resistance. And it is a well-known factor that South Asians have a higher incidence of diabetes. Whether there is a relationship between this and a genetic relationship or ethnic, predilection for polycystic ovaries and diabetes, it's not known yet. That's why the cause is unknown, and there are some metabolic link associated with these conditions. Polycystic ovaries presents with various symptoms, and actually in different age group, different symptoms are priority. So in young girls, if someone has got polycystic ovaries, they have this spots, they call it acne, that becomes a nuisance or a problem. Then they have to be treated for that with some testosterone containing pills like Dianet. And sometimes hirsutism is the main symptom, presenting symptom and the troubling factor in the young girls. They have hair growth on the chins, on the face, around the beard area, and they have it all over the body, on the legs and the arms, and it becomes a problem. Even though they are controlled with these pills, they need to have some laser treatment to contain this hirsutism. That is treated. But then when you come to later age, slightly older women like 30s, when they are trying for a baby, the treatment is conception. where here the hormone treatment or contraceptive pills are not going to be useful. Here, if the woman is not ovulating, then they have ovulation induction to induce ovulation, release the egg, and assist with the conception. Or if it is not successful, sometimes the polycystic ovary is so resistant to ovulation induction, then they consider IVF treatment to get pregnant. So these are all the various treatments. And other important factor is the weight gain associated with polycystic ovaries, because women tend to put on weight easily. If you ask a woman with polycystic ovaries, she will usually say, "Doctor, I'm not eating anything, but I keep on adding, pounds into my weight. I don't know how." And it is because they have this metabolism, low metabolism. Whatever they eat, it adds to their weight. And even if they don't eat a lot, they tend to put on weight. It is related to the insulin resistance and the high testosterone levels in their body. And some of them are now so obese, weight control seems to be the main issue. Then they need treatment for that to reduce their weight. And also this has metabolic consequences. If they are overweight with a BMI of 40 and 45, I have seen women like that seeking fertility treatment, then their weight has to be controlled. And later on, this can become a problem for their heart, blood pressure, diabetes, so many issues. Therefore, to control all these metabolic factors and weight, that becomes the treatment at this stage in life. It depends on where they are in their lives and what symptoms, what problem seems to be the main factor at that time, and we have to treat it accordingly. There is no one treatment for polycystic ovaries. Yes, we have lot of women with polycystic ovaries. In any infertility clinic, 70% of the population do have polycystic ovaries. This population is difficult to treat because of so many factors involved. There are different types, different categories, and some are anovulatory. You can treat them with Clomid or gonadotropin injections to induce ovulation, and they try naturally at the right time. Then they have a baby. It's easy conception. Whereas some of the polycystic ovaries are resistant to all this ovulation induction, then they have to have IVF treatment to stimulate ovulation and collect the eggs and fertilize the eggs and have the embryos put back in to make a baby. And one good thing with the polycystic ovaries is they have lots of eggs. That means they have good number of eggs at the time of egg collection and good number of embryos. The only problem with polycystic ovaries is the quality of the eggs is not so good. Therefore, they have mixed quality of embryos, some good embryos, some not so good. And even though they have lots of eggs, they don't have many good embryos at the end. And that's why it's important to select the right embryo. And nowadays we do what is called pre-implantation genetic testing for women with polycystic ovaries, because they have a good number of embryos and they have one embryo put back every cycle, and then they don't get pregnant because some of the embryos are poor quality and they also have abnormal chromosome. Therefore, it's important to test the embryos to see which embryo is chromosomally normal and which is the right embryo for transfer. So if we transfer the right embryo in the first month, they get pregnant in the first month. So we can reduce the time to their pregnancy by testing the embryos and transferring the correct or the right chromosomally normal embryo in the first month. So by doing that, they get pregnant. So usually it is difficult to stimulate polycystic ovaries because of the high risk of ovarian hyperstimulation syndrome. Since they have good number of eggs and high AMH, when we give even small dose of hormones, they produce lots of eggs, their tummy is bloated, and the ovaries are swollen, and their estrogen is high, and they can have what is called ovarian hyperstimulation syndrome. This is one of the commonest complications of IVF. Everyone with PCO should be aware of it. And all the clinics are really very careful in monitoring patients with PCO to avoid or reduce the risk of polycystic ovarian hyperstimulation syndrome in polycystic ovaries. And that is why the new protocol of freezing all the embryos, transferring in the following month, is very useful in PCO women, because when they are sort of hyperstimulating, it's not a good idea to put the embryo back in, because the embryo success rate is also not so good when the hormones are high. The implantation is lower. And on top of it, the risk of hyperstimulation is increased when we put the embryo and the patient gets pregnant. That's why it's better to freeze the embryo in that cycle and transfer in the next month, which is safer for the woman and also increases the success rate for the woman. That is how we make babies in women with polycystic ovaries. Yes, a lot of women, when they come to my clinic and then say, look, Dr. Venkat, I have this polycystic ovaries. It was diagnosed at this stage. I've been suffering. I don't know when I'm ovulating, and so many issues. And they always ask me, have you seen women like myself in your clinic? So fertility clinics are full of women with polycystic ovaries. So don't despair. It is a common condition. As I said, the range is variable. And it's not the end of the world. There are issues like people put on weight and additional problems with polycystic ovaries. However, there is hope, and the chances of getting pregnant with IVF is good, provided you do the treatment when you are young, not when you are 42. But even then, we can still do it. But because of the good number of eggs, the chances of success with IVF is good. There is hope for women with polycystic ovaries, and it is not a curable condition, but it is a treatable condition, and you can achieve the goal of having the baby with polycystic ovaries.